This is PopHealth Week on Healthcare Now Radio. I'm Gregg, Managing Director of Health Innovation Media and the executive producer and co-host of the show. Joining me in the virtual studio is co-founder and principal co-host Fred Goldstein, president of Accountable Health, LLC. PopHealth Week engages industry leadership and stakeholder voices spanning payer, provider, patient, vendor, and regulatory communities in population health best practices and strategies. Connect with us via www.popupstudio.productions or follow and direct message me on Twitter at Gregg MPH, and that's Gregg with 2 G's. On today's episode, our guest is Leandro Mena, MD, MPH, the director of the Division of Sexually Transmitted Diseases Prevention in the CDC's National Center for HIV/AIDS, viral hepatitis, STD, and TB prevention, where he manages the implementation and evaluation of CDC-supported sexually transmitted infections prevention programs in the United States. Dr. Mena is the founding chair of the Department of Population Health Sciences at the University of Mississippi Medical Center, John D. Bauer School of Population Health. He currently serves as Professor of Population Health Science and Professor of Medicine in the Division of Infectious Diseases, and directs the Center for HIV/AIDS Research, Education, and Policy at the Myrlie Evers-Williams Institute for Elimination of Health Disparities. And with that introduction, Fred, over to you.
Thanks so much, Gregg. And Leandro, welcome back to PopHealth Week.
Thank you. Glad and so honored to be here.
Yeah, it's fantastic to get you back on. There's been a little bit of a change in your career since the last time we spoke. I think it's just over a year now you've been at the CDC. So could you give us some information on what you're doing there at the CDC?
Yes, absolutely. I mean, as you said, in August, last year, I joined the Division of STD Prevention at CDC. So now I direct, the division. The division is within the Center for HIV, viral hepatitis, STD, and tuberculosis prevention at CDC.
And your group, as the director of that group, oversees the sexually transmitted infections area?
Yes, that is correct.
So what does that encompass?
Well, CDC plays an important role in combating, STIs in the United States. And the work of the division includes, assisting health departments, healthcare providers, and other work and others working to address STD prevention with timely science-based information and guidelines on the testing and treatment of these infections. For instance, we have our STI treatment guidelines, documents. An accompanying piece called Recommendations for Providing Quality STD Clinical Services that highlights the services healthcare settings can offer to provide the highest quality STD care for their patients. I have to mention that the STI treatment guidelines are probably one of the most, if not the most, downloaded document at the CDC website. We also provide significant funding to state and local health departments on STD programs, as well as national STD and public health organizations. I mean, roughly 85% of the division funds go to programs and grants.
Wow. And so when I think about it, I know that in some of the statistics, we continue to see an increase in STDs in the areas you're working. And it looks like it's 1.6 million cases of chlamydia, which actually has dropped since 2017. But the others, for example, with gonorrhea, are up 25% since 2017, and syphilis up 68%. So we're continuing to see these increases, I guess, and you're working to try to reduce that. So what are some of the things that you're doing in the communities or with the clinics to try to help with that?
Well, Fred, I have to tell you, we actually released last week our 2021 preliminary surveillance report, and STIs, continue to increase again in 2021. Some of the decreases we saw chlamydia primarily, as we suspect, were probably caused because of the impact of COVID-19. We are seeing, when it comes to primary, secondary syphilis, we saw the biggest year-to-year increase, 26% increase between 2020 and 2021. This is the largest number of cases that we have seen, glad you're sitting. In 73 years, since 1948, we have not seen, this such a high number of cases of primary and secondary syphilis in the U.S. And even more dramatic has been the increase that we have in congenital syphilis of about 24% between 2020 and 2021. Cases of congenital syphilis have tripled since 2017 in the past 5 years. And it's important because congenital syphilis is the one condition, the one STI that is associated with significant mortality. About 7% of congenital syphilis cases, right, end up in infant or mortality.
And so when you talk about congenital syphilis, you're talking about children who are infected at birth or pre-birth and born?
Children who are infected, in uterus, or at birth, yes.
Wow. And 7% of those are associated with death.
Die, stillbirth, yes.
Wow. And how did COVID impact the work of the CDC? I know they put a lot of effort focusing, obviously, on COVID itself. Were some of those resources moved from the STI groups to focus on that? And how did that impact potentially monitoring and prevention?
COVID impact on STIs has really been interesting, right? In one side, increase, awareness of something that we have long known about STIs, which is the long-standing and ingrained social and economical factors that need to be addressed so everyone can achieve optimal health. But the COVID-19 pandemic strained an already crumbling public health infrastructure. We had, because of decreased public health funding over almost 2 decades of insufficient funding, health departments experienced reductions in screening, treatment, prevention, and partner services, all contributing, to the increasing STIs, way before the pandemic. But because of the pandemic and during the pandemic, we saw also significant reductions in personal healthcare services, resulting in less frequent STD screening. We saw diversion of public health staff to respond to the COVID pandemic, and some of this staff was actually permanently assigned, to COVID-19. So we really have not seen a restoration of that. And then there were the lapses, that people having health insurance coverage, due to unemployment. We were lucky enough that as part of the American Rescue Plan, CDC, received $1 billion, to help support and rebuild some of that disease intervention specialist infrastructure capacity. But those funds came again a little bit, late and still, and although still, are being used, right, to try to rebuild, the infrastructure that really was, very weak, at the time of the COVID pandemic started.
I also wonder, Leandro, and you've done a lot of work in HIV and focused on programs to help prevention and people better monitor their health and things like that. Was some of this increase potentially due to the messaging around COVID was so loud and out there, which it needed to be, that maybe there was a turning away from individuals themselves focusing on STIs and things like that, or thinking about them as much as they would have because of that?
Well, Fred, as you know, most of these issues are really multifactorial. And when we think about what's driving the STI increases, I mean, there's no doubt that there's a multi-level factors. In addition to the social and economical conditions, that make people more difficult, that make for most populations more difficult to stay healthy. As you know, poverty, stigma, lack of medical insurance or provider, unstable housing, history, a high burden of STIs in some of these communities. We also recognize that, as I mentioned, the reduction in services that I mentioned, but we also see the increase, in substance use, which has been linked to less safe sexual practices. We are more than a decade in the national opioid crisis that is putting more people at risk of HIV, viral hepatitis, and STIs. And think about the methamphetamine epidemic. We have also seen decreases in condom use among youth and among some group of gay and bisexual men. So it's important. We really must ensure that provider and prevention partners are equipping those who no longer are using condoms for HIV prevention with the tools and information that they need to protect themselves against other STIs. But also, we see the stigma around STIs, right? STIs continue to be stigmatized, and a stigma can really be a powerful, a deterrent, right, from that keeps people from accessing the care, right? That they need both, treatment and treatment, testing and treatment services. As I mentioned, the COVID pandemic has really compounded, many of these challenges and exacerbated, pre-existing disparities in healthcare and prevention access, and further strengthening again our public health infrastructure.
Yeah, it was fascinating when I was looking at this state of STDs report that you released in 2021, and you talked about the racial and ethnic minority groups, and we see that negative impact across it. COVID highlighted it like crazy. Obviously, with STIs, we see it as well. But what really stood out to me was young people aged 15 to 24 are a group that is much more affected. And sometimes we don't think about the younger population around healthcare. So can you comment some on that and some of the areas maybe we can help work with that?
Yeah, absolutely. The U.S. epidemic, STI epidemic, there are tremendous, big disparities, right? There are, in geography. People don't think about geography. United States has over 3,000 counties, right? 3% of U.S. counties are responsible of 50% of all gonorrhea, 50% of all chlamydia, 50% of all primary secondary syphilis. And we know that 48 counties, right, represent 50% of all HIV infection. So we see disparities when it comes to age. As you mentioned, individuals who are 15 to 24 years old represent 50% of all sexually transmitted infections. Racial ethnic minorities and African Americans represent about 38% of all, primary secondary syphilis and gonorrhea. Men who is with men represent, almost 50% of all primary secondary syphilis, when they are only 2% of the US population. So if you think about these populations, right? And I mentioned earlier about the social and economical circumstances, right? That weighed so heavily into the chance, into what determines the risk of exposure, right? And access, to appropriate care. Then you have to start thinking about how can we distribute resources in those geographic areas, right, where they are most needed, and then within those geographic areas, who are the population? Which one are the populations, right, that are most disproportionately impacted, and work with those populations to develop tailored interventions that are specifically responsive to the needs of those populations. And I'm saying that, for example, the way you address a syphilis outbreak in Arizona, in Navajo Nation, is not how you're going to address a syphilis outbreak in Jackson, Mississippi, right? I think that's the kind of tailored approaches that we need.
Yeah, and something you've been talking about for years, and we've talked about on the show, et cetera, is this whole idea of culturally appropriate approaches to the community. And I know that you actually, look at this from an implementation and evaluation perspective as part of this, evaluating how these programs work. What are you seeing as some of the best practices out there that address some of these issues you've raised?
Well, I think that there are a number of things, that we can do. I think, first of all, and I can tell you, it starts right with us. We recognize that we cannot do this alone, and we believe, that we have to work increasing accountability, and responsibility to responding to STIs. CDC. STD programs cannot really take care, be the only ones responding to the sexual health needs of the nation. If we're going to turn this epidemic around, it requires increasing ownership of the program. There's a lot of work, right, that needs to be done, and to address this epidemic, and it's going to take a larger group. Within that, engaging local healthcare systems, clinics, community-based organizations, they're uniquely situated to respond to emerging STIs. And these groups can really play a critical role in promoting, STD prevention at the local level, and empowering individuals to prioritize their sexual health. We need also multi-sectorial, solutions, healthcare, private sector players, have a role in developing and delivering new STI testing and treatment innovation that are desperately needed. And then, I think healthcare providers, can really play an important and pivotal role in reducing stigma by integrating STI prevention and sexual health into the routine practice and creating a welcoming environment to all people. The other thing is that we really have to work, into adopting a syndemic approach, that takes, in consideration all these co-current, infections with the current conditions that contribute to people's exposure to risk, and we have seen, a lot of this happening, in many places in the country where programs are really being creative, embracing, categorical funding, right? To focus around the needs of the individual and meeting people where they are, right? There are excellent examples, for example, in Chicago or Baltimore, basically, where they're working with injection drug user communities, right, and using mobile vans to bring, um, this package, of screenings, that include, for screening and services that includes viral hepatitis, STIs and HIV services altogether.
And so this really is, one of the key areas to look at integration of all services. And you talk some about practices. So what should clinicians and practices try to do, or where can they get some assistance to try and bring in some of these tools?
I think, first of all, I think when it comes to, sexual health, which is again, I think in many ways the port of entry, to a lot of this, and a really an excellent tool, for a clinician to build a relationship with their patients. Clinicians need to start to routinize, sexual history in their routine clinical encounter with patients. It's going to decrease the stigma. It's going to allow them to get to know their patients in a different level. I always say, I used to say when I train, right, we we don't give enough credit, right, to the lives that our patients lead, and and that's the starting point. I mean, the second thing is that we have to take care of the individual when we see them and meet them where they are. Many of these, uh, populations, right, have all these overlapping needs, and I understand that healthcare is not going to take care of poverty, it's not going to take care of food insecurity, will not take care of education. But as a healthcare provider who takes care, if you work in a place where you take care of populations who may have these needs, it's important to be aware of who are the service providers in your community, right, that are going to address the needs of your patients, and somehow establish a relationship with them in the same way that you can send patients to them. They will refer, clients to you, right? So you can work collaboratively, with those organizations to improve, the overall well-being of your patients that we know will be connected to improving, the health outcomes of your patients.
And if you're just tuning in, you're listening to Pop Health Week on Healthcare Now Radio. Our guest is Dr. Leandro Mena, the director of the CDC's Division of Sexually Transmitted Diseases Prevention.
So integrating their practices with those community resources, and it's fascinating. You talk about the fact that they would refer back in, which I think is a great point, because if they're comfortable with what you're doing and understand what you're doing, they're going to help to identify people who could utilize those resources you have and send them back to your practice, which is not really an area I've thought too much about, but an interesting approach. Where do you see over the next couple of years as funding's picked up, and hopefully continues to pick up, you going with some of this work?
Uh, you're very optimistic when it comes to the funding and picking up, but I can tell you the things that I'm really committed. I'm really committed to uh, improving, as I talk about expanding accountability, but the other important area is we have to increase access to sexual health services. I think that eh, I would love to see in the next 18 to 24 months how screening for STIs, right, gets out of the clinical setting. I mean, even tests that we currently have for self-collected of patients in clinical setting should be done outside of the clinical setting. So people can do it from the comfort of their home, from their neighbor's home or from a pharmacy, right? I think that will be in many ways equivalent, to in terms of expansion of access to gonorrhea chlamydia screening to what we had 20 years ago when nucleus amplification was adopted. I foresee one day where screening for STIs is as simple, as inexpensive as going to a pharmacy and getting a pregnancy test. I think that in order to be able to do that, right, we need to also invest in innovation and discovery. We need to have better, methods to diagnose diseases, like syphilis, right? That we still having to rely on serologic testing that requires, interpretation, requires very often sometimes, expert interpretation and access to serologic history that sometimes is only available at the health department. We need, a better oral treatments, for some of our infections like gonorrhea or syphilis, for which we only have really one injectable alternative. And then finally, I think we need vaccines, right? That will be the holy grail. I mean, we have some good news in recent years about the meningococcal, vaccine, the outer membrane vaccine, being 40% effective in retrospective studies, reducing, incident gonococcal infection. So I think that it would be fantastic, right? If we could have the investment and the develop, and see the development of vaccines that will prevent, gonorrhea, chlamydia, herpes, or treat herpes and syphilis.
Wow. So you're really talking about, and we've seen some of this rapid change, obviously, with COVID, and it sounds like a couple of things are sort of related to that. Perhaps in-home testing you mentioned, and you see something like that for STIs and STDs, as well as technology. Do you think some of the move to telehealth might help with some of that access issue? If we can set those up, perhaps just a telehealth for STDs or something like that?
Yeah, absolutely. I think that, telehealth, and home collection or self-testing combined can really close important gaps, when it comes to access to care. Think about how many people live in rural areas, for example, in part because of the stigma around STIs. Even when you may have a provider there, the local provider, that may not be the place that they're comfortable going. I work, as you know, as medical director of an STD clinic, for almost 20 years in Mississippi. And a good proportion of my patients had a primary care provider, right? And when I asked them, well, why don't you go to your primary care provider so he can take care of these things? I said, well, I'm not comfortable, going to them, talking to them about these things. So people, I think there is a place, and there will always be a place for a specialized STD care. The Because people look for because of the expertise, people comes, because of the um confidentiality, right? But people also comes because of the convenience in terms of walking, and low cost. And telehealth can really, become one more tool to increase access, right? To all that.
Yeah, when you think about some of the issues, I remember, even from a mental health perspective, people didn't want to park out in front. Somebody might see their car there. And so you have the same issues with the stigma around STDs, et cetera. So obviously having a place where you can feel safe and confidential and expertise obviously is another critical area. How has it been for you in your transition from the university setting and the clinic in Jackson to working at the CDC?
It's been interesting, Fred. It's a very different environment, a totally different environment. And to be honest with you, I've been here for 1 year, and I still feel that I'm learning, to identify which tools, I have available, to be effective, and how to once, and how to use those tools. So I think, I have a long way. I'm trying to do the best, I can. I'm lucky to be here working with such an amazing group of smart, very committed people, who really see their goal, every day, their goal is to improve the sexual health of American citizens, American people.
Yeah, that's fantastic. And just one final thought in closing. You mentioned this need for taking the public health infrastructure and linking that with the private healthcare system. We've seen how that sort of potentially started with COVID. Do you see that continuing on? I mean, that's obviously a key piece of this. And are you hearing more discussions about that?
I think we have to. I mean, certainly, I mean, in my division, that's our goal, right? We one of the priorities that we have is really expanding partnerships. Not only again with the private sector, but even within the federal government, right? We talk about how housing has such a influence, right, in health outcomes, HIV outcomes, STI outcomes. So we have to work with our partners, in HUD, to see how we can, leverage, and integrate, and work together to improve housing in some of these very vulnerable populations with the overall goal to improve health. So engaging the private sector, engaging the larger healthcare system is going to be important to really improve, public health and population health.
Well, that's a fantastic way to end up this show, Leandro. I want to thank you so much for coming on and discussing this issue, and I'd love to get you back on again as you get your feet more settled and to learn more about the work you guys are doing.
Happy to, Fred. Thank you so much for having me. It's been a joy.
It's our pleasure. And back to you, Gregg.
And that is the last word on today's broadcast. I want to thank Dr. Leandro Mena, the director of the CDC's Division of Sexually Transmitted Diseases Prevention, for his time and insights today. Do follow Dr. Mena's work on Twitter via @CDC-STD and CDC-GOV, respectively, and on the web via www.cdc.gov/STD. And finally, if you're enjoying our work here at PopHealth Week, please like the show on the podcast platform of your choice. Share with your colleagues and do consider subscribing to keep up with new episodes as they're posted. We stream live on Healthcare Now Radio weekdays at 5:30 a.m., 1:30 p.m., and 9:30 p.m. Eastern. And for you left coasters, 2:30 a.m., 10:30 a.m., and 6:30 p.m. Pacific. For PopHealth Week, my co-host Fred Goldstein, this is Gregg Masters saying, please stay safe, everyone. Bye now.